Welcome to my guide to thinking about testing. I am Marco Tan, an emergency physician and graduate of the class of 2006. This video is designed to give medical students a brief introduction to some fundamental concepts regarding how to understand and how to approach testing. As background, we have to understand that all clinical information is data. This data can come from the history, the physical exam, and from testing. This data fits together like the pieces of a puzzle. When put together, these pieces give a more complete picture of your patient. Like a puzzle, some pieces will be more important to identifying the picture than others. As some additional background, a clinician's job is to make this data into useful information. Generally, we make the information useful by trying to do three things. 1. Make a diagnosis. 2. Rule out a diagnosis. And 3. Guide therapy. For tests specifically, realize that your test results live within the greater context of a patient's situation, like we discussed earlier. Essentially, test results live within the context of the clinical findings and vice versa. Together, they give a more complete understanding of the patient's situation. To understand how to use tests, you should understand the strengths and the weaknesses of the test you are considering using. Think of tests as tools. You cannot use the same tool in the same way in every situation. Some tools will be appropriate for some situations, but not for others. For example, consider which is better for evaluating the gallbladder, a CT scan or an ultrasound. As another example, consider which is better for evaluating wheezing, an X-ray of the chest or a stethoscope. As a guiding principle, ask yourself what questions you need the test to answer. Generally, the use of tests falls into three categories. 1. The use of testing as a diagnostic tool. 2. The use of testing to assess severity of disease. And 3. The use of testing for administrative uses. One nuance to these categories is that the same test can fall into a different category depending on the patient's situation. We will go through simplified, concrete examples of these categories in the following slides. Tests can simply give us a diagnosis. For example, a chest X-ray to evaluate for pneumonia. The chest X-ray tells you the presence or the absence of the pneumonia. Testing for severity tells you how bad the disease process is. For example, a white blood cell count can tell you about pneumonia severity, but it does not tell you whether pneumonia is present or not. Lastly, administrative testing helps indirectly. For example, a serum creatinine can help with antibiotic selection. Depending on the serum creatinine, we may have to adjust the antibiotic selection or the antibiotic dose. Finally, a brief summary. All clinical information, including test results, is data about the patient's situation. A clinician's job is to synthesize this data into useful information. All tests have strengths and weaknesses, so make sure to match the test with the clinical question that you're asking. Tests generally fall into three categories: diagnostic, severity, and administrative.